MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on attendees with opinions on everything from healthcare reform to healthcare technology. Here's what they had to say.
One of the fundamental things we're dealing with right now is the Medicare program. It's kind of a foundational issue to move forward with a lot of the reforms envisioned in the recent healthcare reform bill. On December 1st, Medicare physician payments are slated to be cut by 23.6%, and on further cut on January 1st by 6.5%. So our immediate advocacy initiatives are directed at averting those cuts, giving some level of stability for the next year or so, and then really reforming the payment system. Beyond that, there's a lot of interest among our members who are generally the administrative professionals in physician practices who work with physicians at implementing a lot of the new payment concepts that are part of the healthcare reform initiative. And so some of the things we're talking about at this conference include where are accountable care organizations in the mix, how are payments potentially going to be bundled as part of new pilots, and some of the other value-based or pay-for-performance type transitional issues in the healthcare reform bill. There is a grave concern this time around. The scope of the cuts are so great that we are going to be releasing data at this conference that reflects a study that MGMA undertook over about the last month or so. And as part of that study, we asked these very questions. Are you going to participate as a physician in Medicare next year? Interestingly, these cuts come at the exact same time that physicians will be receiving their Dear Doctor letters from Medicare asking them, do you want to be a participating physician in the Medicare program for 2011? So there's a clear link to, even if they don't drop out of Medicare, practices are doing a lot to prepare, because if cuts of the scope we're talking about go into effect, we may very well see practices reducing the number of slots available for Medicare beneficiaries and taking things just to keep their doors open, because when you're delivering care at below cost, you just can't operate a small business that way. The near-term grassroots imperative is critical. Congress will be coming back on November approximately 15th to enter a lame duck session. There are a lot of very high priority issues that we all hear about in the news, such as extension of the Bush tax cuts, alternative minimum tax, a lot of things that are very appealing to deal with to the general public. This physician payment issue is critical, but it may not be the highest priority. So getting it to be a priority in the lame duck session is very important to us. So I would encourage all physicians, their staff, everybody to either go to the MGMA website, some of their physician organizations, be they specialty or the American Medical Association, all organizations that MGMA works hand in hand with on this issue, and to contact their members of Congress and urge immediate action on addressing these SGR cuts. The interesting things that are being discussed at this conference really have to do with some of the economic times that we are in now, and so how to run your practice as efficiently and high quality as possible. And so at least at this conference, it's a key focus of what we're trying to provide. We do it from both the administrative standpoint as well as implementing different processes such as quality reporting, which are clinical processes, but also involve multiple players in the practice to report measures to the government. There's a quality reporting initiative in Medicare. Many payers do have similar programs. So those are the kind of things that we are talking about at this conference and helping our members understand, and in turn, working with physicians and making sure that we can make their lives as easy as possible in a very tough environment.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.